For a small clinic in Ellensburg in central Washington, Awake Health has racked up a big number of complaints. Records show 34 complaints since 2019 on file with the Washington State Department of Health. At least 4 witnesses interviewed by a state investigator are former employees who provided snippets of video evidence.
Me, the priest of the Awake Health.
This video, taken during work hours according to state records, shows Dr. Anna Elperin drinking whiskey or tequila at the clinic, and she will go into rooms and see patients after drinking. All 4 former employees said in the complaints that Elperin abuses prescription drugs and takes Adderall daily and also takes Ativan, a narcotic.
Doc thinks she's joining the Marines.
This video, showing Dr. Elperin with her handgun, was recorded by her former office manager. The doctor has a concealed pistol license, but a former medical assistant said Elperin once pointed it at her face. She has pretended to shoot staff, and all the staff is afraid of her, another employee said of her gun-toting boss. The former medical worker who shot this video said Elperin's advances went beyond suggestive dancing. She said Elperin has gotten naked in front of her at least 5 times. And the doctor asked about having sex with her and also the woman's husband. Employees say Elperin sent vulgar texts of her sexual exploits to staff.
Why are we taking a healthy person and forcing them to put something in their body?
We first reported on Dr. Anna Elperin in November about her opposition to the state's COVID vaccine and mask mandates.
What is happening right now is that we have unconstitutional mandates.
What she didn't know until this interview is that we sent in 4 undercover journalists investigating a tip that Elperin was writing fraudulent COVID vaccine and mask waivers. Hidden cameras rolled as she signed waivers with no medical exam or questions for fees ranging from $150 to $200.
Are you running a vaccine exemption mill here?
No.
Where you're taking payments and signing exemptions with no questions asked?
Absolutely not.
It's not just our story or former employees. Some patients have voiced concerns about Dr. Elperin. You were on medications when you went to see her the last time.
Yeah, for blood pressure and stage 1 diabetes.
Dee Dunphy came here to Dr. Elperin's clinic for a physical exam required for his commercial driver's license. In a statement to the Washington Department of Health, Dunphy's family said Elperin took him off all but 1 or 2 of his blood pressure and diabetes medications.
She said if she could help me with vitamins, get rid of all the medications.
His family told an investigator that Dee ended up later having a seizure and in the hospital. His days as a truck driver are over.
I got a feeling her taking me off the medicines, giving me the vitamins is what contributed to it. But I got no proof. The doctors, they don't seem to know what caused it.
Although it's not clear what caused Dee Dunphy's turn for the worse, Elperin's former office manager says his case and a lack of patient care caused her to quit last year. The state's investigation is continuing, but it does have the power to suspend Elperin's license in the meantime.
So I think it's troubling that there were allegations, which it sounds like were investigated, that did not result in more protections for the public.
This sounds like a case where the board should act and act fast.
These professors, nationally recognized experts on medical law and discipline, question the state board's decision to allow Elperin to continue seeing patients.
Laser hair removal, sweets.
As a doctor of osteopathic medicine, or DO, Elperin's fate is decided by the Osteopathic Medicine and Surgery Board.
A letter from the Attorney General. We have that. Can we pull that up?
These appointed board members, most of them DOs themselves, meet in closed-door sessions to determine whether a doctor's license should be restricted in the face of a complaint.
That's you signing the documents right there, Doctor.
37 days after our original story aired last year, the board voted to temporarily restrict Elperin from issuing any COVID-related waivers, but she is still free to see patients and prescribe drugs.
I think that's concerning because those allegations, if true, certainly suggest that patients may be at risk.
It seems that a reasonable medical board looking at this thing would at least temporarily prevent her from having access to patients and treating patients.
The Osteopathic Board takes the allegations against Dr. Anna Elperin very seriously, a spokesperson said in response to King 5's request for an on-camera interview. There are multiple active and pending investigations related to this provider. As such, we are unable to accommodate the request for an interview. Several individual board members we contacted also declined interviews.
Department of Health is investigating me because I had a disgruntled employee who made a completely untrue statements to the Department of Health.
That was Dr. Elperin in our previous interview. The 4 former employees interviewed by the state investigator did not want to speak to us on camera for this story. But one of them, esthetician Abby Jameson, told us in November that she and her former co-workers feel like the osteopathic board has not taken them seriously.
For them to take this long when she could easily kill someone, it's kind of scary. It makes you not really trust the system.
Our experts caution in this story that they're giving their opinions without knowing Dr. Elperin's side of the story. We have reached out to her repeatedly since our original story to try to get that. She's always responded with insults. Same thing this time around. She texted, "You ran out of real things to talk about, scumbag yellow journalism press reporter." We don't know if she's provided any kind of defense to health department investigators. And Greg and Christine, that's the thing, right? We're not sure of her side of the story here.
There are, so many serious allegations here. Do your experts have any idea why the state disciplinary board would allow her to keep practicing?
Yeah, their research shows that medical boards in many states are often slow to act. That could be out of a fear of liability. Doctors have lots of money to sue. There are also, typically doctors deciding the fate of doctors, and our experts worry that could be an inherent conflict of interest that does not protect the public. So there could be a few reasons there.
Some strange things to see and hear in that piece for sure, and I know we have a lot more.
From a doctor, no less.
Yes.
Yeah, right.
All right, Chris, thank you.